It is my pleasure to host today in this Ask the Author session, Professor Laurent Castera. Professor Laurent Castera is a very well-known investigator in hepatology, especially in the field of steatohepatitis. He's working in Paris, in Hospital Beaujon, and he published, among many publications recently, in Liver International, a paper entitled A European Survey to Identify Challenges in the Management of Metabolic Dysfunction-Associated Steatotic Liver Disease. The situation is so that we have not yet in Europe drugs to treat this condition, but we'll have soon. And so it's very important to be able to identify the patients who may profit from these treatments. But with 25% of the population with a steatosis, it's quite difficult. So it's very interesting to ask this question and to see how they did this work. So Laurent, first, thank you very much for accepting to do this short video, and congratulations to you and your co-authors for this publication. What is the design of this study?
So first of all, thank you, Jean-François, for the kind invitation to giving us the opportunity to present this data. So the design is a very simple design. It's a real-world cross-sectional study consisting of quantitative and qualitative survey of physicians in 5 countries, France, Germany, Italy, Spain, and the UK. And the study was conducted in 2023.
And so with this design, what are the most important results of this study, Laurent?
So let me remind you that out of 12,000 physicians that receive an email, about 2,000 responded. And finally, the panel was 626 physicians, of whom 40% were either hepatologists or gastroenterologists, and 60% either GPs or endocrinologists. There are several messages. The first message is that this physician considered that the presence of MASLD or MASH was highly impactful how they would treat or manage their patients with obesity and type 2 diabetes. And this was the case for 66 to 69% of respondents. However, 1/3 would not identify any MASH-specific clinical guideline issued by international societies, but the awareness was better when dealing with national guidelines. So this is another important message. And to increase the adoption of these guidelines, apart from awareness, they were expected evidence of success and clinical guideline addressing common MASLD comorbidity they deal with.
Few important points, effectively. And so with that, how do you see we could actually improve the awareness of first-line physician GPs regarding this disease?
So first of all, I think this result match our clinical experience and impression dealing with GP, for whom, let's say most of whom, at least in my practice in France, even though they see these patients with non-risk factor, they don't think liver and they don't think MASLD. It's very low priority on their agenda. Second point, the level of awareness regarding the mean of diagnosis, especially non-invasive tests, such as FIB4 or FibroScan, is pretty low. And third, they don't know the clinical pathway. So this is in accordance with the lack of knowledge regarding guidelines, and they are not really aware of treatment coming as well. So of course, the way to improve that is educations, increasing awareness, and also disseminating the pathway and the guidelines. And it's difficult, especially for GP, to reach out to them because they don't have their own guidelines. Endocrinologists have their own guidelines. So you can reach out through professional medical organization. But for GP, I think it's a little less easier. And finally, I think the availability of 2 treatments very soon will be a very good leverage to screen these patients, of course.
Yes, I think as soon as there will be treatments available, the awareness will increase massively, and we'll be there, fortunately, to help. But thank you very much, Laurent, to highlight this publication. Thank you.
My pleasure.